Good afternoon, everyone. Thank you for joining us. Today, this is kind of a two-part or a two-function webinar. The first is to introduce the new ARKITA team, which is the Rural Quality Improvement Technical Assistance Grantee. Telegen is the new grantee for this, and so this is a great opportunity to kind of put voices to names and faces to names for our new TA provider. Also, we are going to be talking about new measures coming into NBQIP. And if you recall last fall or December, I had sent out some information regarding some of the new measures. This is more of an opportunity to talk through those measures and ask any questions you might have. We do have a ramp up period, but we want to make sure to take advantage of all the time that we do have leading up for that ramp up period. So with that said, if you have any questions at all during the presentation, please feel free to put your questions in the chat, or you can come off mute. You have control of your own audio controls. If you're watching this recording and you have any questions, please do not hesitate to reach out to me. And with that said, Ann, I'll turn it over to you.
Thanks, Laura. I'm actually going to kick us off. Good afternoon, everyone. And thank you, Laura. Thanks to all of you across the state of Oklahoma for inviting us to meet with you today and present on the 2025 NBQIP measures. My name is Courtney Ryan. I am a program specialist with the Telegen ARKITA team. And joining me this afternoon are a couple of my amazing peers, one of which will be co-presenting with me today. Her name is Ann Logus. Ann, do you want to come off mute just a moment to say hello?
Sure. Thanks, Courtney. Hi, everybody. My name's Ann Logus. I'm a quality improvement facilitator with Telegen on the ARKITA team, and it's great to be here today.
Thanks, Ann. And then we also have Elena Brotherson, who is our QI lead and helping to run the slides. Elena, do you want to come off mute and say hi?
Hi, everyone. Elena Brotherson here. I'm a quality improvement lead over at ARKITA. Thanks for having us.
Thanks so much. So just a couple housekeeping details. We always get some questions about the slides. We'll be sending a copy of the slides over to Laura following the session today so that she can then send them out along with the recording. And then also, we're going to be covering a lot today. So as Laura mentioned, please feel free to just chat your questions in at any time throughout the presentation as questions arise for you, or jot them down. That way you don't forget them. We've saved time at the end of our presentation for open discussion and comments and questions. And if for some reason we don't get to all the questions or comments that come in, we'll be sure to follow up with responses to send back to Laura so that she can share those back out with you. So let's move on to the next slide. So our objectives for our time together today will be for you to be able to identify the 2025 NBQIP measures, to hopefully have a better understanding than you do right now about the various data elements, submission mechanisms, and deadlines as it relates to each measure. And then peppered throughout the presentation, we will share resources for each measure to help support you in being successful with reporting and data collection. We do want to just note that we've intentionally developed this presentation slide deck so that it can be used as a reference resource for you to utilize. So having said that, we recognize that some of the slides may feel content heavy. And again, there's a lot of information here. But that was purposeful on our part so that you have something moving forward to review and re-review as needed. So don't feel like you have to absorb all of this over the next hour. We encourage you just to begin to digest this information and know that it's here for you moving forward. Next slide. So here is a slide of our ARKITA team so that you have a face with the name of who you might be connecting with. So if we start in the upper left-hand corner, you just met Elena. Again, she's our QI lead and lives in Colorado. I almost said Iowa. and lives in Colorado. Moving right, we have Meg Nugent. She is our program manager and lives in North Carolina. Below Meg is Susan. She is our senior director and lives in rural Iowa. You also just met Ann, who also lives in Iowa. And then there's me in the middle there. Courtney and I live in Colorado. Next slide. So our role as your ARKITA team is to improve quality and health outcomes across our rural communities. And we do that by providing technical assistance and resources to support success in the NBQIP project. So our team is really just here to complement and add expertise related to quality reporting and quality improvement. You all have tremendous support from your state flex coordinator, Laura. So we're really just here to come alongside the team and help support with whatever is needed. You can see on the right-hand side of the slide the resources and the services that we will work to bring you, which include a monthly newsletter, up-to-date resources, guides, and tools, supporting the state teams with one-to-one technical assistance, learning and action webinar events. We have recorded trainings that you can access on demand. And then the last bullet here just includes a hyperlink to the Task Rural Center website, which is chocked with all kinds of rural resources and relevant tools. And then just to kind of dig into that one-to-one technical assistance and what does that mean? So if you need support around measure information or specifications or deadlines, if you need support with data collection assistance and processes, reporting application assistance, accessing and sharing your MBQuip reports, analysis of those reports for the purposes of quality improvement, and then just general quality improvement assistance and education. Next slide. So as we get started, we thought we would just take just a couple moments to level set with a quick MBQuip recap of the current core measures, and then we'll move into the 2025 measures. And on the next slide, we'll start with just highlighting some of the benefits for the importance of participating in MBQuip. And we like to start off by just saying that improving quality of care across our rural communities is really the core of why we all do what we do every day. We all have our reasons of why living and working in rural America is important to us and why we're so passionate about what we do. So one of the most important benefits in participating is for you all to be able to showcase your story, to really just bring awareness of the value your hard work brings to the community and to demonstrate that high quality of care that you deliver. We all know that rural hospitals are so critically important, and pun intended there. And I know I'm preaching to the choir, but just think about how you're communicating and sharing all the great work that you do and how well you do that through your continuous quality improvement efforts in the various reporting programs. The next bullet here highlights how participation in MBQuip affords the opportunity to engage and link with your rural peers, much like you're all doing today, in shared goals and quality improvement initiatives that can forge those peer-to-peer learning and mentorship opportunities, and also to help improve patient experience and ultimately empower better and more informed healthcare decisions. The third bullet speaks to how MBQuip establishes a common set of rural relevant measures that foster the implementation of quality reporting processes, help to build your quality improvement skill sets, and provide data and benchmarking that leads to actionable next steps, which then helps to support this next bullet of increasing your capacity to participate in other federal and state programs, like the value-based purchasing program, for example. In fact, many of the benchmarks for the measures in MBQuip are those of the value-based purchasing benchmarks, with that intent to sort of give you a North Star, so to speak, of where you are in relation to other reporting programs. You have access to Flex program resources and subject matter experts to provide support that meets you where you are. Next, for those of you participating in the Small Rural Hospital Improvement Program, or SHIP, MBQuip is one of the required priority areas. And lastly, MBQuip aligns with the CAW conditions of participation as a quality improvement activity under the Flex program. Next slide. This slide shows the current core MBQuip measures under the 4 domains that you see here, and I know you all know these very well. These include the immunizations for healthcare personnel and antibiotic stewardship under the patient safety domain, HCAHPS under the patient engagement domain, the EDTC measure under care transitions, and then we have the 2 ED measures of OP18 and OP22 under the outpatient domain. All right, so now let's get to why we're really all here today and go to the next section to talk about the 2025 MBQuip core measure set. Now, if you'll go to the next slide, please, Elena. Here is what the MBQIP timeline looks like. So for this year of 2024, hospitals will continue reporting the existing MBQIP core measures as you've been doing as part of the FLEX program. During this year, it's also our time to really prepare to participate in reporting on the 2025 MBQIP core measure set. So we encourage you, if you haven't started already, to begin to think about putting processes and data collection workflows into place so that you're prepared to collect and report the data. It's also recommended that you not only have processes in place, but go ahead and practice collecting and analyzing that data now so that you have plenty of time to work out any barriers that you might be encountering, whether it's something you need to connect with your EHR or your vendors. Perhaps you might want to improve on the measure itself if that's necessary. So just really taking time now to identify what barriers we might be anticipating, what is keeping us up at night, what measures are giving us angst, and having those conversations with Laura and the Archita team so that we have a better sense of how we can best support you so that once the time comes, you're ready to hit the ground running. And then in 2025 is when hospitals will collect the data and begin reporting on the MBQIP 25 core measure set. Next slide. So this is the same information that was just presented on the previous slide. It's just in a more expanded time-like visual. So again, you'll see in the green, this indicates our activities to plan and prepare. So we have plenty of time to plan and prepare for reporting. The gold in the middle is where the submission deadlines for the measures begin in 2025. In particular, the hybrid hospital-wide measures is the first measure that you'll be reporting, which will be in September of 2025. The other measures will be in 2026. In 2025 is when you'll also continue collaborating on your state-specific quality improvement projects. And then as we move into 2026, shown by the purple color, we'll continue our reporting and submission processes and continue our quality improvement efforts. Next slide. So with the addition of the new measures, we will be moving from 4 domains to 5, and those domains will be global measures, patient safety, emergency department, patient experience, and care coordination. These new measures have been thought through carefully and align with other existing reporting programs. And as we just noted on the previous timeline slides, the submission deadlines will begin in September of 2025. Next slide. So this slide provides a quick visual of the 2025 MBQIP core measure set as a whole. So the new measures are listed in blue color, and we're going to be reviewing each of those in great detail. And the existing measures are listed in gray color. So as you can see here, there are 6 new measures, which now give us a total core set of 12. Of that core set of 12, 9 measures will be submitted annually, and 3 will be submitted quarterly. And you'll note that all of the 6 new measures are reported annually. So the ones that are reported quarterly are the ones that you've already been reporting quarterly. All of the new measures are submitted annually. So under the new domain of global measures, there are 2 new measures. That is the CA quality infrastructure measure and the hospital commitment to health equity. Under the patient safety domain, there is 1 new measure, which is the safe use of opioids measure. And then under the care coordination domain, there are 3 new measures. So we have the hybrid hospital-wide readmissions measure, the social drivers of health screening measure, and then the social drivers of health screening positive measure. So now that we can identify what the 6 new measures are, I'm going to turn it over to Anne to walk us through the data elements, submission mechanisms, deadlines, and supporting resources for the measures.
Thanks, Courtney. So as Courtney mentioned, there are 12 measures in the MBQIP 2025 core measure set. The rest of this presentation, we're just going to focus on the 6 new measures, the measures that were in blue on that last slide that Courtney had up. So we're going to focus on the new measures. First, we will review the CAW Quality Infrastructure Measure. This measure is part of the Global Measures MBQuip domain. And if we go to the next slide, we can look at some more details of this one. It is considered a structural measure, meaning that its goal is to measure the environment of quality improvement in an organization and the related administrative processes, policies, practices, and guidelines in place. This measure assesses CAW quality infrastructure based on 9 core elements. Those 9 are leadership responsibility and accountability, quality embedded in the organization's strategic plan, workforce engagement and ownership, culture of continuous improvement through behavior, culture of continuous improvement through systems, integrating equity into quality practices, engagement of patients, partners, and community, collecting meaningful and accurate data, and using data to improve quality. Data is collected for this measure via the National CAW Quality Inventory and Assessment. And you may remember completing this assessment back in December of 2023 with the help of your State Flex program. The results of the assessment were given in December and now are being used to inform some of the specifics of this measure that we'll talk about here in just a minute. So next slide. So why is this measure important? This measure and associated data will allow for national comparisons with your peers. Data will provide timely, accurate, and useful CAW quality related information to help inform your state level technical assistance for your improvement activities. This measure will provide hospitals with state specific information to help inform the future of MBQuip and national technical assistance and data analytic needs that we provide you to help improve. The hospital score will be anywhere from 0 to 9 points. 1 point for each of the 9 elements that I mentioned, and hospitals must attest yes to meeting each of the elements criteria to receive credit. Calculations, a hospital score can be a total of 0 to 9 points, 1 point for each element. They must meet each of the elements in the criteria to receive credit. So, submission for this measure will be annual submission to the Flex monitoring team through the Qualtrics program. Again, if you or your hospital completed the CAW quality inventory and assessment that was due in December, like I mentioned, you're already familiar with the submission channel and platform for this measure. As I mentioned earlier, this is a measurement of the environment. So your data sources will come from documents that your organization has in place, documents that describe your processes, policies, practices, and guidelines, such as mission statements, for example, quality plans, and other documents like that. Next slide. Specifications will be available. They're being developed. Results of the assessment that you took are being looked at, and they are using those to develop the specifications that you will have access to this year. Until then, you can find more information at the National Rural Health Resource Center website listed here. There is a page on building sustainable capacity for quality and organizational excellence. There you will find the CAW quality inventory and assessment instructions if you want to look at those again. All of the questions are there as well, and a recorded training about the core elements of the measure. This is an MBQuip specific measure, so you won't find resources for this measure, for example, on any of the CMS websites. So if you're looking for information on this measure, come to the MBQuip program from your State Flex program, or from newsletters from ARKITA or MBQuip. The National Rural Health Resource Center website is also a really great place to go to for the most up-to-date information about the measure. Next slide. So next, let's look at the Hospital Commitment to Health Equity measure. This measure also is a global measure. one of the global measures. Next slide. This is a brand new measure from CMS as part of the Inpatient Quality Reporting Program. It is a structural measure, meaning it's measuring the environment and does not require abstraction of individual patient records. This measure is reported by answering questions and attesting yes or no to whether or not activities or processes are performed in 5 different domains. Each domain is comprised of a number of subdomains. As an MBQIP hospital, you will enter the Hospital Quality Reporting System, the HQR, and then attest yes or no to each question. I'll break this down for you in the next few slides, and we'll also have a link and some excellent resources at the end that provides some detail and description, again, for each of the domains. Let's see. If you look on the QNet, I also want to mention that there are other hospitals, not critical access hospitals, that are also reporting this measure. And if you look on QNet or the CMS.gov websites, it may mention different reporting deadlines. These deadlines are associated with hospitals that are required to be part of the IQR program. So for information about the first reporting timelines for this measure, please also refer to MBQIP, the MBQIP resources from your Flex coordinator or from the ARKITA team. As far as the specifications and the attestation guide, all of that does apply for all of the hospitals reporting this measure. Basically, the deadline information, get that from your Flex coordinator. Like I said earlier, this is a new measure by CMS and has not been reported yet by anyone at this point. It's brand new, and the CIHs or MBQIP hospitals, their first reporting deadline is May 15th, 2026, reflecting their 2025 activity. Next slide. Why is this measure included in MBQIP? The rationale for this measure, rural risk factors for health disparities include geographic isolation and travel and transportation challenges, socioeconomic status, health risk factors, limited access to healthcare specialists and subspecialists, and limited job opportunities. Rural residents are also less likely to have employer-provided health insurance coverage and often are not covered by Medicaid. The intent of this measure is to help hospitals with the goal to provide an environment in which every patient has the opportunity to attain their highest level of health and help your hospital and community bring forward interventions addressing these challenges to meet the needs of each community. The calculation here, the hospital score can be a total of 0 to 5 points, 1 for each domain. They must attest yes to all sub-questions in each domain to receive credit. There is no partial credit. An improvement is noted as an increase in the total score, which is up to 5 points. I'll take some time now to break down each of the 5 domains. Domain 1 is equity is a strategic priority. We can move to the next slide, I think. There we go. Equity is a strategic priority. So remember, there is 1 point for each domain. You must attest yes to all subdomains with no partial credit. You must attest yes to all of the 4 elements here to get 1 point for domain 1. These elements are common already in quality improvement, and you are acting on many of them, I'm sure, already within your regular quality improvement processes and goals. They are reviewing your quality data and identifying a target population that is experiencing poor healthcare outcomes at your facility, identifying action steps and interventions to help target the patients experiencing poor outcomes, identifying resources to support interventions and goals, and pulling together teams, partners, and stakeholders within your facility and community. As I mentioned, you're maybe doing all of these kind of activities already, but what's different for this measure and domain is that it focuses on moving these quality improvement elements into the hospital's strategic plan. Next slide. This domain is the data collection, is the collection of demographic and social determinant of health information and inputting them into structural data elements in the EHR, meaning that this data can be pulled directly out of the EHR and into reports that your team can use to analyze your patients and help identify target populations in most need of improvement. This is all associated with achieving this domain. The first encounter, so move to the next slide. Domain 3 is data analysis. Using the data collected, as mentioned in domain 2, the next step is performing effective data analysis, as it can provide insights into which patients your quality improvement efforts need to focus on, and what factors may be contributing to their healthcare outcomes that your facility and community need to respond to. Hospital quality improvement processes typically include data analysis, so looking at key performance indicators such as readmissions and hospital-acquired conditions, for example, can include deep diving into patient variables, such as clinical, social, psychosocial variables, for example. And this can help find trends to identify patients that are having poor outcomes. Domain 3 ensures that patient demographics and social determinants of health information are included on the list of those variables that your hospital chooses to analyze and put on their dashboards. The next domain, domain 4, quality improvement. This domain encourages participation in local, regional, and national quality improvement activities focused on reducing health disparities, such as the rural health disparities that your facility may have identified as ones that patients in your community experience. Next slide. Thank you. And lastly, domain 5, leadership engagement. Leadership engagement includes annual review of a strategic plan for health equity and annual review of key performance indicators that include stratifications by demographics and social factors. Leadership in this case includes hospital senior leadership, chief executives, and the hospital board of trustees, for example. This domain is an important piece of health equity to ensure that the work of health equity, the action plan, the data collection, the quality improvement work includes all stakeholders from clinicians to IT and to leadership to help broaden the impact and activity of health equity in our hospitals. Next slide. The first encounter period for MBQIP hospitals for this measure is calendar year 2025. So hospitals can gather information from multiple sources to confirm that they engaged in the activities described in the different domains during the period of January 1st, 2025 to December 31st, 2025. Also, keep in mind, if hospitals participate or complete any qualifying activities at any time during that reporting year, they may answer yes to their attestation. So if you do something on December 31st that helps support this measure, you can attest yes to it. Hospitals must complete their attestation for calendar year 2025 between April 1st, 2026 and May 15th, 2026. The data is submitted through the Hospital Quality Reporting Secure Portal. Next slide. Listed here are some great resources to help you prepare for the reporting this measure. First, the attestation guidance document. This first one is great. It's a great resource that breaks down each of the domains and the subdomains and has resources for helping you work on health equity for all of them. The other resources here are great for highlighting disparities and tools to for you to work on health equity, including a lot of great rural health disparity information as well. So moving on to the next measure, safe use of opioids, concurrent prescribing. This measure is in the patient safety and BQIP domain, and we will talk about that now. So the safe use of opioids, concurrent prescribing. This measure looks at the proportion of inpatient hospitalizations for patients 18 or older prescribed or continued on 2 or more opioids or an opioid and a benzodiazepine concurrently at discharge. This measure is important to report in that patients on 2 or more opioids have an increased potential for adverse events, including overdose and death. This measure will help quality improvement teams identify patients and develop interventions to reduce preventable mortality and adverse events. This measure is calculated as a rate. It's looking at the proportion of inpatients 18 and older who are discharged and continued on 2 or more opioids and an opioid and a benzodiazepine. Next slide. So the safe use of opioids is an inpatient ECQM. It is a current measure of the Medicare Promoting Interoperability Program, and it gets submitted annually for MBQIP hospitals. The first encounter period will be calendar year 2025, with a submission deadline of February 27th, 2026. It's submitted using the Quality Reporting Data Architecture Category 1 file format via the HQR platform. And we'll talk about that a little bit more here. To provide some context and understanding, I want to provide some definitions here. The Quality Reporting Document Architecture, or QRDA, is the data submission standard used for a variety of quality measurement and reporting initiatives. QRDA creates a standard method to report quality measure results in a structured, consistent format and is used to exchange ECQM data between systems. There is a QRDA 1 format and a QRDA 3 format, but for our MBQIP safe use of opioids measure, it is a QRDA 1 format. It is an individual, it holds individual patient level information, and it contains quality data for one patient for 1 or more ECQMs. As an FYI, the QRDA 3 format, this is a report that contains quality data for a set of patients for 1 or more ECQMs and or improvement activities. An ECQM is an electronic clinical quality measure. It is a measure specified in a standard electronic format, as we mentioned, and it uses data electronically extracted from electronic health records and or health information technology systems to measure the quality of healthcare provided. To reiterate, the safe use of opioids is an inpatient ECQM. It's a current measure of the Medicare Promoting Operability Program. It gets submitted annually with a deadline in February, and it's submitted using the QRDA Category 1 file format via the HQR platform. The first encounter period for this one is January 1st, 2025 through December 31st, 2025, with a submission deadline of February 27th, 2026. see, we are on the right slide. There we go. So this slide just describes the population details again for you, including the inpatient measure population, and the encounter, the numerator and the denominator for you, and some exclusion criteria and details on what patients you would include in your numerator and denominator. Next slide are some resources to support you to get started in collecting this data and submitting this data, including a link to the detailed measure specifications and data elements that will be helpful to you. Next slide. The next two measures will be very similar, so I won't go into full detail on each of them. They are kind of connected. And we'll start with the screening for social drivers of health. So we can move to the next slide there. This is a new CMS measure under the IQR program. The submission will be a numerator and denominator that is submitted annually through the HQR portal. So you're not submitting patient level data. You're not using a CART tool or a vendor tool. It's submitting a full year of numerators and denominators. And it's a percent of patients 18 and older admitted for an inpatient stay that are screened for all of the following health-related social needs. They're looking for these 5: food insecurity, housing instability, transportation needs, utility difficulties, and interpersonal safety. They are not specifying a specific screening tool that you use. You can choose that, but you need to capture all 5 of these. Within the specifications manual that we'll share, there is a list of suggested screening tools, and we also have provided a link for that in one of the upcoming slides. Again, this is a new measure for all hospitals, not just MB-Equip hospitals, and we can move to the next slide here to just look through just the rationale, the recognition of health disparities and impact of health-related social needs has been heightened in recent years. Economic and social factors known as drivers of health are known to affect health outcomes and cost. This measure is derived from the Center for Medicare and Medicaid Innovations Accountable Health Communities model and has been tested in large populations across states. The intent of this measure is to help ensure hospitals are considering and addressing social needs in the care they provide to their community. Next slide. Again, the numerator is the number of patients 18 and older that are screened for all 5 social drivers, and the denominator is the total number of patients admitted that are 18 years and older. So you will need to screen almost all of your patients, but there are 2 very important exclusions to keep in mind. Patients can opt out, and they don't have to answer the question, but if you've asked them, you have screened them, meaning patients can decline to answer the screening questions. That is fine. It will not go against you in your numerator and denominator in your rate. So if you document that, just be sure that you're documenting that you have screened them, even though they didn't answer the specific questions of your screening tool. Also, there is another exclusion if patients are unable to answer as well. That won't go against you in your rates. You are meeting the measure by screening the patients. There's nothing in the measure with
what I can do
with what is done with the answer. So if patients are screening positive, there is nothing in this actual measure that records what you are doing for your patients. We know you are doing things for your patients, but that isn't part of this measure, and does not need to be calculated or included in the submission of this data. Next slide. The encounter period for this measure is calendar year January 1st through December 31st. The first MBQuip encounter period is January 1st, 2025 through December 31st, 2025, with the first submission deadline being May 15th, 2026. And this also is submitted through the HQR system. Next slide. Linked here are the specifications and suggested screening tools that you can use to guide you. And with that, we will move on to the next measure that's somewhat related here. This measure piggybacks on the last one. This is a screen positive for the social drivers of health, and it is also in the care coordination MBQuip domain. Next slide. The other piece to the social drivers of health is that there's also an additional data element here to count, and that's the number of screen positives to the social drivers of health measure. Again, this is a new measure, and it would be reported the same way you do with the numerators and denominators for the social drivers of health. The denominator would be the total number of patients screened, and the numerator would be how many of those folks screen positive. Again, there's nothing here about what you do when they screen positive. Simply, this measure is a count of the number of positives for each of the 5. Next slide. To reiterate, this is a new CMS inpatient quality reporting program measure. The same exclusions apply if the patient opts out or is unable to report or complete the screening, or if they expire during the stay. When you look on the QNet sites and IQR sites, keep in mind that the specifications definitely do apply to the MBQuip hospitals to you, but for the first reporting periods and deadlines, definitely refer to MBQuip materials. This is the same encounter period deadlines as with the other social drivers measure. January, it's a calendar year starting in 2025, and the reporting deadline is May 15th, 2026. The one important thing to note with this measure is that it will be calculated again in 5 separate rates. So you will have a different rate of positive screening for each of the 5 health-related social needs. This is helpful because it will tell you where the greatest needs are in your communities in terms of social drivers of health for each of those social needs categories. And similar to the other SDOH measure, this is submitted through the HQR platform. And these are another slide here for resources to support you. So for the last new measure of MBQuip, I will pass it back to Courtney.
Thanks so much, Anne. All right, everyone, hang in there. This is the last measure. So this is the hybrid hospital-wide readmissions measure, and it falls under the care coordination domain. So it's probably no surprise that a focus on reducing readmissions continues to be strong under our national quality strategy and with the various reporting programs. CMS is currently using the hospital all-cause readmission measure in the other reporting programs like IQR and some of those that we've been talking about. So again, in that effort to align MBQuip with these other programs, we will now prepare to report on what is called the hybrid hospital-wide readmission measure. So the description for this measure is that it is a hospital-level, all-cause, risk-standardized readmission measure that focuses on unplanned readmissions 30 days of discharge from an acute hospitalization. And so if we unpack this description just a little bit, hybrid is basically a way of differentiating a measure from the claims-only measure, as this measure is going to merge electronic health record data elements along with claims data elements to then calculate that risk standardized readmission rate. So ultimately, this hybrid methodology was developed to allow for a more comprehensive assessment of hospital performance in addressing complex and critical aspects of care that they weren't able to identify by just dissecting claims data alone. So it's a good thing because it allows us to do a deeper dive into improvement opportunities for those complex care cases. So again, hybrid is going to be taking data from claims and data that's going to come out of your EHR, and then CMS will be marrying the two on the back end and putting them through an algorithm that ultimately calculates your risk standardized readmission rate. Next slide. When it comes to the rationale behind this measure, the impact it has for our patients is pretty obvious in that a readmission is very disruptive to lives, to families and caregivers, but also readmissions increases our cost on healthcare systems. Readmissions increases risk for healthcare associated infections and other events. But what we're really honing in on for this measure is wanting to improve health outcomes for those patients that have a higher probability for readmissions. Again, those complex care cases, and having good communication and care coordination processes in place around discharge planning. Next slide. This just kind of talks about the initial population. So it's all of your Medicare fee-for-service and Medicare Advantage encounters. Next slide. I won't go into too much detail as far as the numerator, denominator, and exclusions, but this information is here for you as you begin to kind of map out your processes and build out those functionalities within your electronic medical records. Next slide. So this slide talks about those core clinical data elements that are going to need to be mapped in your EHR on the left-hand side. And then on the right-hand side, you'll see what CMS is calling the linking variables. That's the information that's going to be on the claims data. So for the clinical core clinical data elements, you can see that there are 13 of them. You can essentially categorize them into two buckets. You have vital signs there in green and the labs in blue. Remember, the intent for this measure is to be able to drill down our critical care cases so that we can better identify ways to improve the health outcomes for those folks, as well as the communication with our patients to avoid an unplanned readmission. So as long as you have your clinical data elements that you're able to pull out of your EHR, you'll be uploading that and submitting that, and then CMS will be taking the information on the claims data to marry the two on the back end. Next slide. This is also just more for your information as you start to get into the weeds of it. This just provides some guidance around when you're extracting those clinical core data elements. So it's the first set. You're not going to be submitting every set of vital sign values or lab results that you get during their stay, but it's just that first set that you're going to be extracting. So there's some information there for you. Next slide. I want to just take a minute on this one. I'm trying to be mindful of time, so we have plenty of time for questions. But we do recommend that you prioritize preparing to report for this measure if you're not already comfortable or have processes in place to do so. So we've highlighted this because notice the submission date and the encounter period. So you'll see that the first MBQIP encounter period is July 1st of 2024 through June 30th of 2025. And the submission deadline is September 30th of 2025. So this is the first measure of all of the new measures, the new 6 measures. This is the first measure that you'll be submitting. All of the other measures that Ann just discussed will be reported in 2026, but this one is going to be reported starting next year. So prioritize this measure. Start to think about what those processes are that you need to have in place, the EHR functionalities, all of those kinds of things, so that once September comes next year, you're ready for this one. This measure is also available for reporting now, so there's a good chance that there's other peers across Oklahoma that you might be able to connect with and kind of pick their brain for some best practices or lessons learned as they were getting things set up. So definitely take advantage of that. Next slide. This is just for the visual learners like myself. It just kind of outlines those steps necessary for successful submission. So you'll be collecting and extracting that data. You'll be populating that data into a QRDA Category 1 file, submitting that file through the hospital quality reporting system. And then again, that data will get married with claims data on the back end by CMS, and they'll calculate that measure and report that back to you. And then the next slide just goes over some resources specific to this measure. We also included some resources for the QRDA1 file. So if that's something that's not familiar to you, there's an implementation guide on that, as well as some schematics that you can share with your IT department so that they can build out that functionality and be able to upload that type of file to the hospital quality reporting platform. Next slide. So this just kind of brings it all back together. So again, for the total 2025 MBQIP core measure set, there will be a total of 12 measures. We have 6 new measures. Those are indicated in blue. The current measures that you've been reporting are the ones in gray. Anything with a star is currently available for reporting now. So if there's a measure that's there that you're not quite sure what to do, take advantage of those peer-to-peer connections that you have. And then just noting that the hybrid measure is going to be the first measure you're submitting in 2025. All of the others will be submitted in 2026 of the new measures. Next slide. These are just some new resources that are hot off the press. You've probably seen them come through the ARKITA newsletter. So we have the MBQIP 2025 information guide, the MBQIP 2025 submission deadline. So that'll be a great one to kind of print out and have handy. And then there's some state flex program key resources as well. Next slide. These are some resources that we are working on wrapping up right now as we speak. So we have some measure submission guides for all of the measures. So it'll be like screenshots for where you go, how you access, what you click on, what all the different steps are for each of the measures to help you with submitting them. We also will be recording a video of the MBQIP 2025 measure core set and reporting details, much like what you just heard today, so that that's available on demand. And then we have a quality improvement basics recorded series. So this is a 3-part learning series. Each part is 30 minutes long, just helping support build your quality improvement skill set. So things like how to do a root cause analysis, how do you implement interventions using the Plan, Do, Study, Act methodology, things like that. So that's available on demand. And then if there's other additional quality improvement skills that you would like to know more about or have access to resources or tools, please reach out because we have a lot of them. Next slide. So just shifting gears really quick before we move into the Q&A, on the next slide is a slide that you might want to flag. This is just a quick visual for the reporting channels for all of the measures. And again, you can see the new measures that are indicated by stars here. All of the new measures will be submitted annually, and they'll all be submitted through the hospital quality reporting platform, except for that quality infrastructure one that Anne spoke to, which goes through the FMT Qualtrics platform. Next slide. So just some next steps for you. Be on the lookout for deadline reminder emails from Laura and the MBQIP newsletter. And just really, again, emphasizing to start early. So explore these measures in more detail, report on them if you can. If you have angst about any of them or know that you've got barriers, let's have those conversations now so that we can connect with who we need to connect with and do what we need to so that come 2025 and 2026, you're ready to report on those measures. And then the last little block there is bookmarking the measure specification manuals on the QualityNet website for quick access if you haven't already done that. Next slide. Won't go into too much detail here, but this is just more for your reference of some tips on some of the most common reasons for rejections and resubmission of data. So that's there for you. The next slide has a couple of the sites that we encourage you to bookmark if you haven't done so already. You probably have. The first one on top is the Quality Reporting Center, and the one on the bottom is QualityNet. We do also encourage you to subscribe to the different email listservs that you see there. That's CMS's way of communicating with you, whether it's things that are going on with HARP or the CART tool or a new update or guide that's come out. So make sure you've got those coming into your inbox. And then, as you already know, that's where you can locate the different measure specification manuals, access the CART tool if you use that, and then register for your HARP account. So with that, I think we have just about 4 minutes. I apologize, but we can go ahead and open it up for any thoughts, questions, comments. And again, if we don't get to them, feel free to just put those into chat or share those with Laura, and we'll be sure to follow up with responses. But I'll go ahead and stop now and just see if there's any questions.
While everyone's thinking, this is Laura. I just want to note, there was a question in the chat earlier. Yes, we are recording this, but we will also be sending out these slides with the recording link once it's posted. I'll also send out the MBQuip reporting guide that was mentioned earlier, as well as the submission deadline chart that includes the new measures. But I did want to note, when you do look at the chart, so we talked about all of the submission deadlines today of 2026 and then the late one in 2025. Hospitals do have the opportunity to submit in the first round or early submission, and that would be pretty much all of those deadlines moved up 1 year. And so I know we have many folks on the call today who are part of a system or attached to a larger facility who's already looking at these measures or working on these measures now. If you're able to submit not with this current time this year, but next year, I would encourage you to do so because, as mentioned earlier, these are all once per year measures. So it'd be like a practice run to see about getting our data in and what it looks like.
It's a lot to take in.
Please know I'm learning with you guys. These are all very, very new to me, and this is one of the biggest changes to MBQuip we've had in many, many years. So please know I'm learning with you guys, and folks on the call or watching the recording, if you have any questions, please do not hesitate to reach out because odds are I have the question too, or I haven't thought of that question, and I'll reach out to our folks at Archita to get their feedback.
Thanks, Laura. And Elaine, I don't know if you just want to put up our Archita website if you have it, or email if they need to reach out to us. But on behalf of our team, thank you all so much for the opportunity to connect with you all and be with you today. Again, it's a lot to take in, so just use this as a resource. As your questions come up, let us know. Laura, let us know how we can help support you. So we're here for all of you. You're definitely not alone. There's lots of support.
Yes, thank you all today for the presentation, and please reach out, everyone, if you have any questions. Thank you all.